Often, when we take ill, we pop antibiotics to fight the infection. Antibiotics are powerful drugs. Used judiciously, they save lives. But over time, infectious bacteria can become resistant to antibiotics. These drug resistance bacteria are on the rise, and their presence is notorious in hospitals, which are antibiotic-rich environments. What's the best way to contain their spread? A group of Korean researchers addressed this global healthcare challenge by examining fecal transmission of certain resistant bacteria among ICU patients who are most at risk of developing such infections. This video provides an overview of their work. Bacteria like Escherichia coli and Klebsiella pneumoniae produce enzymes called beta-lactamases that can break down antibiotics like penicillin and carbapenems and render them ineffective. This study looked at two such drug-resistant organisms, ESBL-E and CRE. Rectal swabs were collected from 347 patients before they were admitted to the ICU. A battery of microbiological and molecular biology tests were performed to screen for the resistant bacteria and study their genotype. The researchers found that 98 patients carried ESBL-E, and one carried CRE at hospital admission. For the non-carriers, the test continued every week with the aim of detecting any bacterial pickup. And interestingly enough, 11 patients acquired ESBL-E, and 4 acquired CRE during their hospital stay. A sizable number of these bacteria were E. coli and K. pneumoniae, and most of these harbored the CTX-M genotype of ESBL. Overall, ESBL-E had a high fecal carriage rate and a very low acquisition rate. Studies suggest ESBL-E spread rapidly, and the number of carriers is on the rise. So active surveillance of these bacteria is not cost-effective, and strict contact precautions should be undertaken. Although fewer patients carried CRE, it is still important that their spread in hospital settings is continuously monitored by rapid and accurate clinical testing and by adoption of recommended control procedures. As this study shows, these measures will help reduce the prevalence of such infections in Korea. And this is important given that Korea fares worse than many regions of the Western world with regard to ESBL-E prevalence.